This week at the vet, another visit from the dog with a serious bleeding nose. We visit Shaggy to follow up on him after his operation, and a puppy is in with a swollen throat. First, we visit the home of Portia, the dog with the bleeding nose.
Still at the blood with the country. I don't know come and stay there. But I decide forget another dog.
Tasha.
Why you going around here now?
Yeah. This name Tasha.
Could I go take Portia now hospital? What me happen to Portia na come now? Somebody me not come bank Portia with blood me come on.
No, just some kind of blood. No, just no more blood.
So Portia die, how am I feel? Adios.
Feel bad. Sorry.
I feel bad.
Feel sorry for the dog. We miss in love because after when you see we walk, you don't come to school, they can't jump away, they float we. So we miss them so much. We take Portia, we go to where and waterside.
When I don't say wait till I don't say enough fine. Wait, don't for laugh, it's serious. You get animal where you get where you like, they die, you go to another side. You know so now treat Portia bad. Or go meet you, say Portia don't die waiting for you. We tell us so now for go bury him. Go to another side, you know the police the water side. So this dog here, now we can go. I was put to Tori where you go. After 2 months, add to this, now we do the operation. Okay? Then no go born.
Well, in cool, in quiet, not like Portia because Portia can be too wide. What they sing, okay.
We went to visit Shaggy's in his home to see how he is doing after his castration.
He's okay. He's wild. He encourages strangers to come around. He will bark until we quieten him down. And he bites sometimes, to chase, especially children. But otherwise, he's been good since he got the castration. He's getting fat now. But gradually, he got well. And you see him, he's putting on weight. I know anytime somebody comes into the gate, he will bark. Even if he's lying down somewhere, somebody touches that gate on the other side, he will bark, so we will know that somebody is about to come in. That's one very good reason why we always like Shaggy. We have gone through that every 6 months. You know, we come to the clinic and they give them the vaccines, the 2 of them, with Shaggy and Snoopy. So they are okay, they are up to date in terms of vaccines. He's stronger, he doesn't get sick, he's getting fatter as well. And I think we are happy he went through that surgery. I don't know if dogs have personalities, but this one, it's really a dog that you can have at home for many, many reasons. Like I told you, he's a good guard, and he will secure your compound. He'll make sure that intruders don't just come in anytime they want. At least you know the flow of traffic when people come in and go out. These children here, they are the kids who really take care of Shaggy.
Yes, he is a good dog. Shaggy is a friend to me. Shaggy is a friend to me.
We visited Kube and the owner of Hoodie and many other dogs who gather around Hoodie.
They take and they come to here. We say they come to here, so what's up they can do. So I take a rescue him. He with me, so think he don't used to me. So sad enough for me get another day. I'm our leg and the man gets leg. I'm not going to say company defeats him, but it's not easy. He guide Mount Salman. He do with people and so I believe for like the Mount Salman with Oluna creature. They get great role they play to me inside. They collect for men and I'm in place. I'm in security there. I'm in your environment for the hola. Get in and no one they give me problem. Yes. Just like how they live so no more. See people they know them. Now be bad Mount Salman them for to me, they're not for the Nyami. But they know say are so good to them. And they give for them, so them back and used to me any carry. After 12, nobody knocking past me surrounding again. Because in Bembe need agree. Yes, if I sleep safe, I go no say post in the pampas here. And security na the one whole community safe. Yes, because elect Mount Salman back like him. Because he go see you then midnight. You want go any side safe. You want go say PZ, what is sabi you? He dey go with you. So Mount Salman then like him for that. I know about that rib injection. But I know say any carry one day government must succeed for kids and creatures.
Back in the clinic, Ami is back again for her routine treatment for her skin disease.
She's a bit better, but she needs a lot more treatment, I think. I'm afraid, yeah? Come on. Come on. Let me come. We didn't do very painful. He had surgery last week. No, internal.
Ah, okay, please.
Yeah.
Okay.
Exactly. So this is the ivermectin?
Yeah, sure.
Okay, great. Can you do it down here? Is that okay? So I don't have to lift her?
Yeah.
Good girl. Good girl.
Okay.
Wonderful.
Okay, so we hope to see progress and then see her on Saturday next.
Yeah, Saturday. See you then.
Next in is a female cat for an operation.
I don't know the age. I can just guess this is about 6 to 7 months. This is a female cat. The owner brought her for spray surgery so that she can't get pregnant. Like for animals, we say on heat. That's the time, like this one now, she's matured. That's the time they are matured and they will accept other male animals to have sex. So during that period, that's the time they will get pregnant. And there are certain days of that heat period, if it's finished, they will never allow any male animal to have sex with them again. That's about 21 days. But the actual standing heat about 7 days. After that 7 days, they will have sex and they will not be pregnant. And that will also help to reduce the population of stray cats and dogs. Well, those who are eating cats, it's not good because they helped us. Because with cats, with dogs, we say they are security outside for thieves and other things. For cats, they are security inside for rats and, yeah, mostly for rats inside the house and sometimes outside. So it's not good for eating these things. It's not our culture of eating cats and dogs.
She has already woken up, as you can see, but she just peed over the sky kennel, so we're just trying to make sure we clean it because our concern here is practically welfare. So we make sure every animal we handle, we make sure we follow the post-surgical protocol, which means the animal should be safe, should stay in an environment, although this is not ideal for this purpose, but because of safety, we wouldn't just have to let her out, because for cats, like I've always said, it's very tricky to handle cat, because the moment you allow the cats to go, that's the end of it, and we don't have any explanation if somebody brought his or her pet here and then we say, okay, he went out or he escaped. That's not the rules here. The rules here is that every animal that is here, we should make sure we be very, very meticulous about their safety and their well-being. Zainab and I, together with Lahai, we had well over 25 different clients coming in with their pets. So it was like going there, examining, taking case history, coming down, giving a receipt. So it's just like doing everything at a moment, because people want to go for their weekend shopping, so they have little budgeted time for their animals. So you don't need to, you have to make good use of this moment, because this is the time they have here. And thank God we were able to, as a normal routine, to make sure we treat every animal, we talk to every pet owner, we advise every pet owner. So this is a normal day. So we listen carefully to every case, because our patient or our client don't talk. So we always depend on what people tell us. That's why we are always advising people to make sure you are closer to your pet, because the moment you have that bond, if there is anything abnormal, you can be able to identify it, which is very, very important for a diagnosis, because if you don't tell us, we cannot make out a diagnosis, we cannot give the proper treatment.
Next in is Ray for his mage treatment.
He's a compound dog, so we are living in a compound and there are a couple of experts. And one of them, he left the dog, and since then he is living with us. And he has mange, and we have been here, and it has always already gotten better, much better, with the treatment of Dr. Jalloh. But then afterwards there was a change in the people who were on the compound, and nobody really knew exactly what to do and when to come back. And so the mange is back now, as you can see, here, and he's always scratching. So we are back at point 1 to start the mange treatment, this time correctly.
Is there any dog at your compound? Only Jay?
It's only Jay, but sometimes he's going out. Basically his family is in the neighborhood. Yeah.
But that's another issue again, because we need to stop the cycle, because if there are mange dog around, because this thing transfer.
Yeah.
So if it is impossible actually to stop dog from moving around, But if there is any means that you can limit his activity outside whilst he's on treatment, that will help a lot.
Okay. He's on treatment, don't let Jay out.
Is this scratching?
Yes, a lot.
So let's just see if it is fleas, because fleas can be a secondary problem also.
Okay.
Because when fleas bite, scratching, and the mange also scratches. So, okay, as far as my eyes could see, I wouldn't see any fleas. Okay, so fleas is off the record now. So we're dealing now with just the mites. So we'll start the treatment today, and you need to come back next Saturday. It's a weekly routine.
And how often?
Well,
approximately?
like this might like 2 months in a row, so we can take like 8 weeks, and then see every week he needs to have the shot.
So basically for 8 weeks?
No, every week. It's a weekly.
Okay, for 8 weeks,
yes.
Every week we should come back.
Yes, but possibly we finish like 3 weeks, we see some mark improvement, probably a month. I'm just making a work plan that will fit in based on the diagnosis.
Okay.
Yes.
So that's very good to know.
Possibly it couldn't be 2 months. Yes, because this is a medical treatment. Every animal responds differently to treatment.
Okay.
So with 2 months, I'm sure, because we need to have medical wash done in between. After a fortnight, we do 1 medical wash. So after another fortnight again, we do 1 medical wash.
Okay.
Because it's
and for the time being, it's 1 injection per week.
Yes.
Okay.
Yes.
Sounds good.
Yes. It's important we don't miss any of this routine. If by any means you're too busy, we have a vehicle service that you can give us like few days notice, and then we can pick the gentleman up and then come have the treatment done and then drop him again. We
How
have
much is that?
Where do you stay?
Off Spurlow. It's a compound dog.
Okay, you just inherited him, eh?
Exactly. Yeah.
Okay, so who was the previous owner?
Somebody who left like 1.5 years ago, and he
Details.
No details at all.
Okay, well now we should have given rabies, but because of this skin problem, we'll wait. It's okay, then we can give the rabies.
Okay.
Because it's very, very important when you are taking dog from somebody to make sure the rabies vaccination is okay.
Okay.
Yeah, so but we cannot give vaccine now because of the skin problem.
The next patient is a puppy with a swollen throat.
Under in throat now swell, then you operate, then body not the fine, body don't. Make a cow and then check her. Maybe okay, in body fine, you don't get problem. That's not very 6 weeks. Then they say no to that.
And this dog in one day house?
No.
You got a small one like this day?
No, this one is not a small one.
But a big one, eh?
Yeah.
Almost big one.
Not too big one.
So you get for try for bring and come here. Because there are a lot of people. So you're not the only place. So you get for things and big one there. Okay, this you get for come Monday because some kind of infection swelling in the lymph node. You go treat them there until we collect that swelling they go down. Because I'm more making a cow time. So we also get more medicine, yeah?
This dog has come in for a rabies injection.
Anti-rabies vaccine, now 1 game.
Take good care of him, chill on the whole of the day. At night I left him, get some air and then put him inside back. Like, it helps to the doctors and they never tell me when I will come back. Actually Monday I go there if I can do the castration for this dog because if I only be a decent and home dog, you know, not only be a street dog or house dog, be a home dog, so you get a good training and good wrap up and I want nothing for disturbing.
These two dogs have come together The older one has a flea problem and the puppy has ticks.
She's been eating, but she's not putting on weight. And then this morning she didn't eat her food.
Wow.
And I bought her dog food. She eats sometimes, then other times she doesn't.
But this is like mange again.
I wash her every Sunday. I take her ticks off every Sunday.
No, but this is severe mange. Well, I would advise we have this flea drop. Yeah, we use a flea drop. That's mange.
I thought it was ringworm.
No, this is mange.
Oh, it's mange?
Yeah,
How
it's
did
mange.
she get mange?
Well, you know, like every dog has a little bit of mite under the skin. If there is any problem, then they start to replicate. Then you will have a lot of mites and they start to cause havoc. Yeah, okay, so, but because you see, this fleas is everywhere. And you see, this dog is, there are lots of fleas. Okay, we'll give you the powder this time around. There's some powder that you use. Because the problem is the flea is always around. So even when you finish washing them, you go back to where the eggs are.
You don't wash them every.
Yeah, it's a complete cycle, so we need to break the cycle. We'll use the powder instead.
The powder?
Yes, because the powder is more better. Because if you notice, when you finish washing using the chemical, when you go back, they're infested again.
Yeah.
And we can wash today, and then you will do the powder like tomorrow, because the fur needs to be perfectly dry. Yeah, so we can do the wash. And then you can also wash that little lady. What's the name of this one?
Zina.
Zina.
She came with
You're
her
part of this trouble
brother,
again, eh?
but her
So you
brother
survived?
died. She has ticks. I cleaned her ears yesterday. No, Thursday.
There's a
But
lot
they
of
keep
ticks.
coming up.
Yeah, ticks is difficult to handle, you know. It's one of the ectoparasites
Yeah,
that's
they-
different. But they are from the shrubs, the garden, they are always there. They hang on the leaves, so whenever the animal just pass through, you just find it as a host. And then they make sure they bite and stay there for survival.
That is it for today from the vet. Join us next week for more animal stories.